how many types of colic are there? So we answer all kinds of questions on colic, so we'll definitely put the link in the description here and at the end of this video for you. But this is a great question because I think this is when people get hung up on a little bit.
They do, and it's there's a number of ways to look at this. Do you think we should like define colic, or is that in other videos and they should?
That is in other videos, but I think it might be a good way to anchor us here a little bit.
Oh, okay, good. So colic is plain and simple. It's defined as abdominal pain in horses. So it's not associated with it's not associated even with the GI tract, and for sure not in any particular segment of the GI tract. So it's just pain in horses, and it manifests as, and I think one of the other videos has like a rolling list of pawing and rolling and looking at the flank and maybe going up and down and sweating and high heart rate. And
well, I think people think sometimes colic has to be this huge like episode or scene. It is literally could just be pain in the stomach and biting the stomach. It doesn't have to be.
And I
this,
suspect
like,
we don't know of a lot of colics that happen in our horses that are overnight or out in the pasture where nobody's watching them.
I totally agree with that.
So we've covered all the signs and symptoms, and the risk factors I think are in a video too. We also cover what to do and what not to do, like hand walking for hours and hours and hours. There's no benefit in that. You can look at colic as you mentioned, mild, so medical colics that are treated, either not treated, because they were that mild, they went away on their own, or they were treated on the farm, like one visit from the vet, just some Banamine, and maybe they tubed the horse and it was all fine. Or the ones that the vet comes to the farm and treats the horse, and they are able to stop the pain for a while, and then like in 30 minutes it comes back. And those are the ones that, particularly if you have colic care, the colic surgery reimbursement program, you get referred to a surgical facility, and surgery might be
which is the worst when they're like, is your trailer hooked up? You're like, okay.
Is there gas in the truck?
Yeah.
So medical and surgical are two types, but I think what the person was asking was what causes colic.
Okay.
So there's the AAEP has a wonderful PowerPoint presentation and a brochure on their website, and they classify colic three ways. Intestinal dysfunction, which would be the most common one, and those are the mild medical ones. Then intestinal accidents, and those are things that can only be corrected by surgery, so those are more severe.
Twists and things like that.
Yep, and then inflammation, ulceration, and those are named by the segment that is affected. So if you have diarrhea of like the large intestine, it might be a colitis. Or the small intestine would be an enteritis. So that in there would be stress, medication, parasites, sand, and infections. Back to the intestinal dysfunction, those mild ones, those are your spasms, the gas, like a gas colic.
Yep, you hear that one a lot.
Yep. Impactions fall under that because those might be able to be resolved with mineral oil or that's less favorable now, just putting fluids into the gut with the stomach tube is been shown to be better at resolving impactions than mineral oil. We used to think that oil would go around the impaction and sort of soften and smooth out.
Yeah.
It's better to put fluids in, and they get into the impaction and soften it from the inside out, and then it just dissolves, it breaks up, and then it passes.
A little new tip for all of us there.
In intestinal accidents, so those are the surgical ones, can be things you mentioned, twists and entrapments. There's one where entrapment where the right dorsal colon flips, it displaces it. It goes over the ligament between the spleen and the kidney, and it gets stuck there.
The horse's anatomy, it really can do some
I know,
crazy
I think
things.
it was designed by committee, so that's really good. There's also one called intussusception, and it has as many S's in it as you think, and that's a telescoping, so that a segment of bowel telescopes into another one. And once it does that, it doesn't usually come back out, so that's also surgical. That's not as common.
These are quite scary.
Yeah.
But these are things that, unfortunately, we have to deal with as horse owners, and there's all kinds of things that can happen with them.
Right.
And colic, unfortunately, is non-discriminatory towards horses. It can really, unfortunately, happen to any of them.
Yep.
And that's why we do programs like Colic Care to kind of
Yep.
give people a little bit of reinsurance of peace of mind that if they do have to make a decision,
We're
have some,
behind you.
have some options there for sure.
Yeah.
So hopefully that helps you out and did not scare you too much.